first of all, I want to thank all the members of Infection Advisory Committee and for the work that they have done, during this time. And, the reason why it has been important in the pandemic is I think one thing is to recognize that we were dealing with something critically important, which was going to come and make a pretty significant and dramatic change in the ways that we were going to work in our long-term care facilities and make a significant impact on the patients and the residents that we took care of. So I think the first thing was the recognition, and I think some of us in the committee were able to see that coming, anticipate, and come up with guidance. And I think and that guidance has been used so well by all our medical directors and our clinical providers all across the country, and for that, we are extremely thankful. But to come out with guidance, anticipate how COVID is going to affect us, and then come out with the tools to combat that in nursing homes has been, I think, great work that the committee has done, and I can't thank them enough for that. So. Well, it's been long 2 years. What we have achieved now is really the tools that, kind of have started crystallizing in our mind as to when, infections, no matter which infections, right? COVID, any other viral infections, flu, they come in. What are our pillars for keeping our patients safe? And some of those are adequate use of PPE, infection control, rallying your staff, of course, behind it, and then vaccines and testing. So these are the pillars of how we have realized that we deal with COVID. And hopefully, as we understand the principles of how viral infections travels in our buildings, to use some of those tools proactively and intuitively and nimbly is what I hope that my fellow clinicians would be able to take home from this pandemic and actually take forward. Maybe, we don't know what COVID is going to do after this. But, hopefully one day this settles down. And then what are we left with? We are still left with, a lot of viral illnesses that come through our facilities, things like flu, parainfluenza, other viral illnesses. And how do we take those principles that we have learned from COVID and apply them to make sure that we are keeping our patients safe, even during those times when, there are these endemic illnesses that come through our nursing homes. The other important thing is that what we have learned during this pandemic is how to work with our staff and rally with our staff, rally our staff as a team. And I hope that we take forward in everything that we do in a nursing home. So that's what I hope that we would be able to take home from this. Obviously we are keeping a close eye on what COVID is doing and, what is going to happen going forward. The committee has been working some behind the scenes with, CDC, long-term care division to give input and, our views of, what works and what doesn't work in a nursing home setting. Certainly, there are other illnesses, like I said, pneumonia vaccine guidance has changed. And, I am assuming, that is something that we are going to come out with in the future and look out for that, just the ease of, how do you kind of address those pneumonia vaccines and who is eligible for what and make it a little bit less complicated than what it is right now. So that is something that is on the radar. Plus, one of the things that we did realize during COVID time is the accessibility of information was extremely important. So now we are working with, AMDA with the website development and make sure that all the infection control issues and infection-related issues, rather, are in a easily accessible box for you to access, from previous articles to current articles, but certainly what has come through recently and what changes practice in long-term care from infection perspective will be hopefully accessible to all our members as well. The other thing is, some of you may have come to our talk, which is a new thing that we have introduced this year. I wrote an abstract for research that changed practice in long-term care as far as infection issues are concerned. And I hope it gets to become a yearly session where we talk about the research, the great research that gets done, and some of it gets published in JAMDA, and talk about how what that research means and how can we take it straight to the bedside, because that's where it gets utilized and kind of has a full life cycle of what it was meant to do. So those are some of the issues that we I hope we take forward.